Hello everyone, you're welcome to my channel. My name is Henry and today we are on Rhythm Studio. We're going to talk about something very important that has to do with the OSCE. I am making various videos on the stations. Currently, I am trying to talk a little bit about the planning stage because a lot of people have requested about how to memorize or the simple way to memorize the planning stage. Without going much into details, I'll give a very short mnemonic that will help us to generate ideas when we are writing there, and especially the interventional stage. I'm going to briefly give you a summary of what the planning stage is all about, and then we go directly to our main plan for today. With the OSCE planning, you have about 14 minutes to write, and with the 14 minutes you have about 2 problems to identify, and then you come to the interventional stage where you're going to identify the various steps or the things that you need to do as a nurse to manage the patient of those problems. It is very difficult to come across all the points, especially when you have about 7 minutes for each problem, and that's not the time to think when you're writing the planning in there. So this acronym is going to be very helpful to be able to memorize and remember everything when you're writing all the points you need for the planning. So in terms of writing these nursing interventions, you need to focus on 3 major things. First one is that it should be current, and it should be of best practice, and it should be evidence-based. So to understand all these things, I would need us to think about these problems that we often get when we are encountering patients. We could get patients who are in pain, having anxiety, depression, wound or skin issues, or signs of infection. Having these in mind, I want you to focus so that when you are generating the points, you'll be able to relate to all these problems, and it's going to be very easy when you have a problem to write an interventions about. So the acronym that I'm going to talk about is E.M.A.T.A.R.I.D. I know a lot of people might have come across this, and then many will be asking, how do we apply this E.M.A.T.A.R.I.D when we are writing about the intervention stage under the planning? So this is the reason why I'm making this video, so that you'll be able to remember them when it comes to the day you're writing about it. With the E.M.A.T.A.R.I.D, E stands for explain the procedure and seek for consent. Before you come across with your patient, you need to explain whatever you're going to do for the patient, and you need to get consent. You can't just go and bump into a patient and start doing anything. It's not respectful and it's not professional. So the first thing you need to do is to explain the procedure and seek for consent. So in terms of writing this in your nursing intervention, what you're going to say is that before initiating my intervention, I will explain the procedure and all aspects of care to patient's name in clear terms and give consent to proceed, ensuring they feel comfortable and informed. You could make the sentence in your own words depending on how you want to go about it, but this is an example that I have generated to assist you to be able to memorize and put something there. It should be freestyle and nothing is supposed to be according to what I've provided. So with the patient, you put the patient's name in there, and then you start writing something related to what I mentioned. So the next point that has to do with the M is monitor patient's observations or vital signs. So before you go on with the patient, you need to know the vital signs of the patient. Some problems will require you to monitor the vital signs of the patient. So if these problems are in line with this, what you need to do is you want to write that you're going to monitor the patient's vital signs. And so this is an example for you. I will monitor the patient's vital signs and escalate using the news score. So this is basically for you to know that you're going to monitor the patient's vital signs, which includes the blood pressure, the pulse, the saturation, and then the respiration. And then with a news score that you will get, you escalate accordingly. And you know, with a news score, we have various ways to escalate. When you have a patient who has a news score of a certain number, you know how often you're supposed to monitor the patient, and you know whether to escalate to the doctor or to the nurse in charge, or you have certain measures you're going to take along. So these things be in mind that you're going to do. And mind you, it's not every patient that might be needed to have this vital signs done. So this E.M.A.T.A.R.I.D is basically to make you know that you have certain points to look at, but make sure it's applicable to the patient's problem you've identified. Just to add that not all patients who are applicable to the news score or monitoring the vital signs. Some patients you need to monitor the Glasgow Coma Scale, and with the Glasgow Coma Scale, you're checking the neurological assessment of the patient. And that will help you to also escalate your API station. You should be shown which one you should deal with, whether the news 2 or with the Glasgow-Coma scale, or you're doing both of them. You should be very particular when you are talking about it. The next one we're going to talk about is the next A, which means assess patient's condition. So whatever patient you have and the problems that you have identified, you should be able to assess the condition particularly and have a specific tool to deal with. You don't generalize everything. You should be very specific about whatever you are identifying. So now I'm going to talk about some of the problems that we do encounter and some of the assessment tools that we need to use. So to be able to be specific with this particular assessment, you should be able to tell the assessment tool that you are going to use to assess that patient. In everything that we do for a patient, we have something standardized that will help us to know whether the patient is going off limit or the patient is okay. So these are the tools that we look at, and they are general for everyone, including NHS and the private hospitals. So you getting to know all these assessment tools will be able to prove to whoever is marking your exams that you know what you're talking about and you know the assessment you are really talking about. Some of the assessment tools that I'm going to talk about includes, first, with pain, we have pain assessments 2. Anxiety, we have generalized anxiety disorder or the GAT-7. With depression, we have PHQ-9 questionnaire. With the skin or wound or pressure ulcer, we have the Askin bundle. With infection, we have sepsis 6. With nutritional status, we have MAS-2. All these tools are very important to be able to tell whoever is marking that you know what you're talking about and you know what you're going to do for your patient to achieve that particular intervention. So to make it very simple, providing you with an example, I will say I will assess patient's condition by evaluating their pain level using the pain assessment tool. So that could be one of them if the patient pain is the one you're dealing with. Or you could say assessing the mental health with the PHQ-9 questionnaire to identify any signs of depression. So these are all freestyle. You write it the way you think you'll be able to remember, and then you look at those assessment tools and then the required problem we are assessing. This will help identify and be specific when it comes to your intervention. The next T stands for teach patients on various interventions. So you know you have your patient, and then there are certain things that the patient needs to know in managing themselves. It's not everything that should be pharmacological or interventional by the nurses, but you could also support the patient by teaching them certain things that they need to do to support themselves. So some of the things that you could talk about if it has to do with pain is to teach patients some of the non-pharmacological methods to manage pain, which includes diversional therapy and the likes. So these are the things you're going to teach patients. If it's all about using the crutches, you're going to teach patients to move using their crutches. So these are various things that you can teach your patients to be able to support themselves. The next A is administer prescribed medication. So with this, you need to be very specific with the kind of medication you're talking about. If you're talking about pain and you need to administer medication, you need to be specific with what sort of medication you're going to give. If analgesic, if it's anti-sickness, if it's antibiotic, you need to be specific. And in fact, if you know the medication that you are going to give directly, you can also stick your neck and say, I'm going to give or administer prescribed paracetamol 1 gram to my patient to alleviate the pain. So you need to be specific. You can't just say I'll prescribe medication and not being specific. So the problem that you have identified, the problem that you're talking about, you look for the main medication used for, or the group of medications that are meant for those problems. So if it has to do with pain, you are going to administer prescribed pain medication or analgesics. If it has to do with feeling sick or nausea or vomiting, you're going to administer prescribed anti-sickness. If it's something for depression or anxiety, you're going to administer prescribed anxiolytics or antidepressants. So these are the things you need to do. All that you have to do is to be very specific in what you are saying to prove to the person that you know what you're talking about and get all the available marks. So an example that I will also write is, I will administer the prescribed medication, specifically exact medication name, ensuring that patients understand the purpose, dosage, and potential side effects of the medication. As I said, it's not supposed to be by my words, but it should be freestyle. Write something that makes sense, and then that is very specific to what you're talking about. The next is R, which is refer to the appropriate multidisciplinary team. So we have various teams that comes together to support our patient. Those teams include the pharmacist, the occupational therapist, physiotherapist, the nutritionists, the nurses, the doctors, everyone comes together to form the multidisciplinary team. So you're going to refer appropriately to the right MDT, which has to really associate with the problem that you have identified. So if the problem has to do with pain, you could refer to the pain nursing team or the pain team to look at that for you. If it has to do with physio or mobility, you could also look at physiotherapists and also maybe the occupational therapist. You're also going to refer to nutritionists if it has to do with diet. You're going to refer to the required MDT, which is appropriate. So PAR stands for referring to the appropriate multidisciplinary team, and you know which one you are dealing with. So an example include, I will refer patient to the appropriate multidisciplinary team members such as the physiotherapist for mobility uses, the pain assessment team for pain management strategies, and a tissue viability nurse for the skin integrity concern. It must not be the same as mine, and it's not that every patient may have this, so don't copy blindly. Just be specific and know which one you're talking about. If it's about pain, you're going to refer to the pain assessment team. You can't say you're talking about pain as your identified problem and you're going to refer the patient to a nutritionist. How is the pain related to the nutrition? Unless the eating is affecting the patient or causing the patient pain, then you can justify, but you have to be very specific. Make sure what you're talking about makes sense. The next I stands for inform the patient on how to do certain things. You're dealing with a patient. The patient might also need certain information on how to go about things. If the patient is in a hospital setting and the patient is in a private setting, or even if in a cubicle where they have loads of people, there should be a means that they could contact you if they need you. They shouldn't be screaming or shouting to call you, but there should be a call bell that they could press to call the nurses to attend to them. If it has to do with how to operate the bed, they should know how to operate it by certain ways. So you should be able to inform them on how to manage all these things. So this is the stage where you write that you will inform the patient on how to do certain things. So you need to be also specific regarding this. If it is about the call bell, you say, I will inform patient on how to use the call bell when they need me. If it's about the bed, you are going to inform the patient how to operate the bed, because some patients may want to raise their leg up, raise their head up, lower their head, and they shouldn't be always calling you all the time to do that for them, but they should be able to do them by themselves. So this is where you inform them how to do it. So an example that I will say is, I will inform the patient how to use the call bell. Just to add up, you should be very careful when it comes to OSCE, because certain settings should be making sense to you. Especially you might have the patient in a hospital setting, or you might have the patient in the community setting. A lot of people fail because they confuse themselves which setting they are dealing with. So if you are dealing with a patient in a hospital setting, it makes sense to say you're going to inform them how to use the call bell. But if you're telling me the patient is in the home and you are going to inform the patient how to use the call bell, it doesn't make sense. So you should be very careful how to deal with that. Patients that are in the community settings, one of the things that you could also consider is that you're going to inform the patient how to call the emergency by using 999 or 111, or calling their GP. So these are the difference you have to deal with when you are dealing with a patient, either in the hospital settings and the community settings. So we should be very, very careful about that. The next D stands for document. So you're going to document all the interventions that you did for the patient. You know, documentation is very critical and very vital when it comes to nursing. And so whatever you do, you need to document them appropriately, so that any situation you'll be able to be covered. So one of the examples that you can talk about, I will document all findings and interventions in patient's medical record to ensure continuity of care and facilitate communication among the healthcare team. This brings us to the end of the E.M.A.T.A.R.I.D. If you are able to remember E.M.A.T.A.R.I.D in this sense, no matter the problem that you identify, you should be able to associate it and write around it, and it should be very simple for you. But mind you, you should know first of all the settings that you're dealing with. If it's the hospital setting or the community setting, you should know certain interventions do not apply in the community, and certain interventions do not apply in the hospital. So whenever you are giving the planning, you should be able to identify that setting first, and you should ask yourself, this intervention I'm going to do, will it apply to the patient in the hospital or will it apply to the patient in the community? Another thing to consider is to make sure you are specific about the activities that you're doing for the patient. Don't just generalize things that I will monitor vital signs. Just vital signs doesn't make sense, but you should be able to be specific, especially the problem and the things that they need to be monitored. Especially, let's say you are dealing with a patient having infection, and then you are going to monitor the vital signs. What are the things that could affect the patient or could change with their vital signs? You're going to check about their temperature, check about everything. You're going to be specific about what you do. And then you should also be specific by mentioning the patient's name. Don't just say, I'll monitor patient's vital signs. No, I will monitor Mike's vital signs. That should tell you that you are dealing with Mike and is specific about it. All these things are the things a lot of people feel about their planning stage. And if you take them into consideration, you should be able to pass your planning stage. This brings to the end of our conversation today. If you liked everything that I said, and if you like anything that I'm doing here, I want you to subscribe to my channel. I want you to follow. I want you to share my videos to your friends and whoever needs this, and then be able to spread across so that everyone will be able to understand all these things and they'll be able to pass their exams. Thank you so much for being with me. I wish you all the best in your exams and you come out very successful.